So carpal tunnel is basically just a compression of the nerve to your hands. So a lot of times people present with numbness, tingling, mainly in their thumb, index, and long finger, sometimes their ring finger. A lot of times they wake up at night because they have night symptoms, so they feel like they have to shake out their hands in order to get it to feel right. They can't drive because the vibration causes can be anything from, could be job related, kind of overworked, that type of thing, or whether diabetes, that can lead to a little bit increased over risk. Pregnancy can also increase your risk a little bit. Thyroid disease can kind of increase your risk a little bit. So anything kind of inflammatory affecting your anatomy can give you carpal tunnel. So the first step for carpal tunnel is usually kind of a non-operative approach where we try night splints, we try anti-inflammatory therapy, and sometimes that's all that people need. But sometimes then, if this happens more consistently or more frequently, then they need to have something more done. And so I usually send them for an EMG, or which is basically a big test, and it's not a fun test, but it's a test where you can test how well your nerves go, or how well the signals work through it. And then based off of that, we kind of talk about surgery. So surgery is just basically opening up of that tunnel that the nerve sits in. So it's just incising the ligament so that it gives the nerve more space. The actual surgery is just about maybe 1.5 centimeters across the bottom of your palm. I do it open because I find that there isn't much difference between open and endoscopic, if patients do read up on that. And it's in and out the same day. They have a regional anesthesia, so they don't have to go to sleep. They tend to get the pinch back in about 4 weeks because the muscles that control your thumb also attach to that ligament, so they just feel sore. And a lot of times it takes about 2.5 months to kind of get your grip back fully. You're going to be able to do that a lot sooner. But I usually send people home in a dressing, and in about 3 days they can take it off. They can start using their hand normally after a few days.